7 centimeter Zenker's diverticulum. The upper endoscopy at the outside hospital was unable to discern the esophageal lumen. CT neck and chest shows a 6.8 centimeter Zenker's diverticulum at the upper esophageal sphincter, shown here circled in yellow. Plan. After review of the patient's history and endoscopic evaluation, the plan is to proceed with Zenker's peroral endoscopic myotomy or ZPOEM.
Soft cap on the tip of the scope, and we can see this is the septum here. This is a little tight, and the esophageal lumen, and this is the Zenker's. So this is an impressive Zenker's diverticulum. I'm gonna demonstrate a modified technique, which I call open ZPOEM. We've been doing it for a while now. And so basically, it's a regular ZPOEM, but we, with complete opening of the diverticulum, complete cutting of the mucosa, the remnant mucosa at the end, and then without closure. So we don't place clips. You see, we have already here, let me freeze here. Let me get you a better picture, actually. So this is a septum here. So I'm just going to cut it a little bit to give ourselves some space so that I can discern anatomy better. Open. So one thing that can happen with these big Zenkers, open, is that at the bottom of the diverticulum, there can be a lot of, close please, right. A lot of fibrosis because of stasis. So we'll see what happens at the bottom. By the way, we're using EndoCut Q, effect 3. And you see a little bit more coagulation effect with the SP knife. And this muscle here, I think we're gonna just cut a little bit more open. So this is closed, a little bit more trimming of the muscle based on our new delineation of anatomy. And here the mucosa is below the muscle. So that's what's important. So now we look here. So you see the sac is completely gone. There's no mucosa. The anatomy is very well delineated. And now you go, of course, straight to the esophagus. I don't need to close this or put clips or anything. And now we're just going to apply Purestat, and we will be done. My practice is I admit these patients, we get an esophagram the next day. We do that once we start a new technique. So like for example, POEM, when we started doing POEM, everybody gets admitted, everybody gets esophagram. Now we do POEM as an outpatient.